So, hi, thank you for joining me today, both of you. We have Anna Lorens, the head of the Genetic Laboratory Clinic at Salve Medica, and Helena Wang from BGI Genomics. She's the Chief Technology Officer of Oncology. So, to start with, could you both maybe introduce yourselves, tell us a little bit about your work? Anna, let's start with you.
Okay, hi. I am the head of the genetic laboratory clinic Salve Medica in Łódź. We are located in central Poland. We have also clinic in Warsaw in Poland. Our main specialization are oncology and fertility. So in our laboratory, we our daily basis are tests for these two specializations.
Excellent. And Helena, how about yourself? Can you give us a quick introduction?
Sure. Hey, this is Helen here at BGI. So I work for BGI Group, and right now I'm directing the R&D department here for BGI Oncology. And BGI is a company that focusing on genetic testing service and products here in China. Now we are also trying to bring our products and service to the rest of the world.
Perfect. Thank you. So we're talking today about colorectal cancer. Colorectal cancer is the third most diagnosed cancer worldwide, with almost 2 million people diagnosed in 2020 alone. With such a high prevalence, who should be screening for colorectal cancer? What kind of patients should be screening for it, and how often?
So colorectal cancer screening now is generally recommended for everyone starting at age 45 to 50 years old, depending on which guideline you're looking at. At the same time, people with a certain family history of colorectal cancers or certain genetic conditions may be need to be screened for earlier or more frequently. And there are various methods for colorectal cancer screening that are currently in use, such as colonoscopy and fecal immunochemical test, FIT, or stool-based DNA test, which we will discuss later. For these methods, also there could be different intervals that would be recommended for these different screening methods. For example, colonoscopy is really recommended to be performed once every 10 years in most guidelines. But for the fecal immunotest, then it probably needs to be performed once every year. And for DNA tests, it can be done, every 3 years or so. So there are more and more options now that people can choose from for colorectal cancer screening.
And Anna, does that fit with what you've seen in terms of the screening approach?
Yes, in Poland, as in other European countries, colorectal cancer is becoming more and more common. According to the data of the Polish National Cancer Registry, is the one of the most common cancers next to the lungs, breast, and prostate. Among men in Poland, it is the third place with an increasing trend in morbidity, with a simultaneous stabilization of mortality. But for women, CRC is the third leading cause of cancer-related deaths. In 2020, the number of colorectal cancers in Poland amounted over 1,600 cases, 1,000 cases. However, we have to remember that in 2020, there was approximately 13% decrease in reported cases compared to 2019. However, taking into account current activities and trends, it is estimated by our experts from Warsaw universities that the number of detected cases of colorectal cancer in Poland may increase in 2030 to over 2,700 cases. It's quite huge numbers.
Yeah, it's massive. It's very interesting. So I guess the decrease in reported cases was due to the pandemic, people generally just underreporting non-COVID illnesses in general. So there's probably, overall, an important case to be made for screening and checking and reporting, potential cancer symptoms early, to kind of build that back up to, sort of post-pandemic. So, Helen, why would you say that it's so important, to promote colorectal cancer screening, particularly early screening?
Yeah, so I think the screening for colorectal cancer is critical because it can really help detect the disease early. And what's important to point out is that colorectal cancer, the development of the disease can be a very long, prolonged period of time. So it can take anywhere from 10 to 15 years for the colorectal epithelium to develop from normal cells to cancerous cells. So it would actually go from normal epithelium to polyps, adenoma to advanced adenoma, and then eventually those cells can undergo malignant transformation to become cancer. So if we can perform screening, and then we would really have a good chance of catching the disease at either an early stage, for example, a localized stage of the cancer in that form, or in the form of a pre-malignant stage. The cells can be found at the precancerous stage where you can just perform a surgical removal. So you would actually just take the disease out of the colon. So this can really make a huge difference. Either when we find the disease at the precancer stage, even before the cancer arises, so that this is where you can have a chance of prevent the disease, or you can find the disease at a localized stage, and then there you can have a very good chance of treating the cancer successfully. So people have a good chance of survival.
Yeah. And so, Anna, in Poland, what's the sort of public awareness, the level of public awareness and government awareness as well of the importance of early screening for cancer in general, but particularly for colorectal cancer, where it may not be as common, as well established, that early screening is so important?
Yes, in Poland, the subject of cancer prevention appears more and more often in public space. For several years, we have a lot of cancer prevention program. For example, breast, lungs, uterus, head, and colorectal, of course. These programs are mainly financed by the taxpayer. We all know that prevention is better than treatment. So I have some example. In Poland, there is a saying, quite humorous, that there are no healthy people, only untested. We can take this as a joke, but but it seems to me that there is a great fear of hearing a diagnosis. So, in my opinion, there is enormous work that we must do socially, doctors, medical center, and government, of course, to convince Poles that we should not to be afraid of preventive examinations. They allow us to monitor our health more often, and when a disease is detected on early stage, we have a big chance to treat, as Helen said before.
Mm-hmm. So, Helen, with colorectal cancer having such a high prevalence, and a growing prevalence among other cancers, what are the latest recommendations for colorectal cancer screening?
So actually, we noticed there's a trend that certain guidelines are now have been updated in recent years. For example, the American Cancer Society recently actually updated its colorectal cancer screening guideline to recommend that average risk individuals to start screening at age 45 instead of age 50. And this is actually due to the fact that there has been a pretty remarkable increase in cases of colorectal cancers, the disease incidence in recent years in younger folks. So what it really stands out is that we have to really want to promote the screening at an early age in order to help detect and treat the colorectal cancers better. I think the European guidelines is still now recommending to start screening at age 50, but who knows, maybe there will be a continuing efforts to update the guideline to reflect this change in the disease incidence.
And you were talking before about the different options for the different kinds of screening that can be used. Can you talk some more about those, the sort of technical details and how they work and what the differences between them are?
So the gold standard of colorectal cancer screening is due a colonoscopy, and is widely used in clinics. Although it comes with certain limitations. For example, it's still quite invasive procedure, and the preparation process of colonoscopy is also can be quite time consuming and also quite unpleasant. So people, there are certain folks that would never want to do a colonoscopy, although they really hit the age where they really want to start screening, but just because the preparation can be so painful, right? And there are also certain risk of complications that come with colonoscopy, such as bleeding or infection. And some individuals also, because of the fact that colonoscopy is an invasive procedure, some people may never be able to take a colonoscopy as a screening option. So with that said, there are a few different options for non-invasive screening for colorectal cancer, such as a fecal immunochemical test that I mentioned before, the FIT test. So the FIT test really is a immune test that used an antibody to specifically recognize hemoglobin in the stool. And with that, it can actually detect the small amounts of bleeding in the stool that are not visible to our naked eye. So when the blood is detected in the stool, it really means that there may be a polyp or a cancerous growth in the colon epithelium. So when the test results are positive, then further examination would be recommended. And usually in this case, colonoscopy would still be recommended for the patients to further diagnose the condition. And with that said, FIT also has certain limitations because usually it's generally believed that it has limited sensitivity and specificity. So what it means that a negative test may still miss certain precancerous lesions and the cancer condition. And also a positive test could also means that there's some other conditions that in the colon that will cause bleeding, but it may not necessarily be a precancerous lesion, a polyp, an adenoma, or the cancer itself. So there have been some recent developments in the molecular diagnostic field to figure out other ways to detect colorectal cancers instead of relying on the FIT test. And with that said, I mentioned earlier that there have been efforts to develop these stool DNA-based tests to detect the colorectal cancers. With this test, so they usually try to detect abnormal DNA in the stool. So what happens is that we in the normal epithelium there is constant turnover of the epithelium cells. So we can actually find pieces of these cells debris in the stool. So this actually provides us a chance of finding abnormal pieces of the genome in the DNA, and which can provide us a pretty good opportunity to detect the existence of cancerous cells.
Mm-hmm. Yeah, that's fascinating. So, Anna, from those screening options that are available, what are the most used in Poland at the moment? What are the options available for patients?
As I mentioned earlier, we have in Poland screening program, which covers people between 55 and 64 years of age. Under this program, patients receive an invitation to perform a free colonoscopy every 10 years. In addition, patients in Poland have the opportunity to perform the FIOBT or FIT test. And unless popular methods such as colonography or sigmoidoscopy or endoscopic capsule, but these are commercial.
Mm-hmm. So, as we were talking about before, with the guidelines for screenings sort of increasing, hopefully getting potentially more regular or applying to a wider age range, what do you think the sort of general public's reaction to that would be? What would be the sort of clinical challenges with that, as as Helen was saying, with colonoscopies being sort of so invasive?
Yes, our awareness of the importance of prevention and screening is growing year by year. Many organizations are involved in promoting these activities. Many patients hear about the word colonoscopy, give up and postpone the test until, for example, they are not concerned any symptoms. Many people have recently talked to me who, due to their positive family history, have indication for the earlier colonoscopy from 35 years, they said they had decided to have a colonoscopy, but if they were to do it more often, which in their case is just advisable, there for them is a quite big problem because most of them is active professionally. So colonoscopy or colonography, when this examinations involves being off work for a few days because it requires appropriate preparation. So in addition, each patient who has a different pain or discomfort level, for many, this is a very big psychological or mental barrier. We also met with patients who cannot have a colonoscopy due to leaky intestinal walls, allergies to anesthetics, heart attack in the last 3 months. So DNA tests are a good solution for these patients.
Mm-hmm. So, Helen, can you tell us a little bit more about stool DNA testing and why it's a good alternative, and about BGI's new solution for that?
Yeah, sure. So BGI now has this new product called Colotect, which is actually a non-invasive self-sampling based test for colorectal cancer. And how it works is that so you just need to take a self-collect a stool sample and send it back to the lab in this preservation solution so that it can keep the DNA stable in there. And what the Colotect test detects is the abnormal DNA methylation, which is literally a form of a modification on the genome. And the DNA methylation is actually a hallmark of the malignant transformation of the cancerous cells, the malignant transformation of the normal epithelial cells to cancerous cells. So by detecting these usually trace amount of abnormal DNA in the stool sample, we can actually find out whether there are these signs of cancerous transformation in the colon. What we have found is that the DNA methylation test can actually provide a very good sensitivity and specificity of detecting colorectal cancers and also advanced adenomas and other advanced precancerous conditions. So because whoever needs to be screened for using this new product only needs to self-collect a stool sample. So what makes it really easy to perform at home. So you don't have to worry about privacy issues and all that stuff. And all the tests can be done in the certified laboratory, and a pretty accurate result can be sent back to the patient. And then if you get a positive result, what means that there may be higher risk of abnormal cells present in the colon. So then whoever had received this test result can just go to the patient or health provider to receive colonoscopy to be further diagnosed. And if the test result comes out negative, then what it means that there is no abnormal signal detected. So this can, with this new strategy, we may be able to save a lot of unnecessary colonoscopy procedures. So that's the whole idea behind the DNA test.
That's great. So it's a much more selective test than the other non-colonoscopy options, as well as being obviously non-invasive. So Anna, how does that sound to you? With that high sensitivity of detection, what potential do you see for that in for patients and in clinical settings?
Oh, I believe the start of screening in the form of a test that does not require several days of preparation, and yet its sensitivity and specificity is the highest among invasive method, is a big step towards increasing the detection of colorectal cancer at early stages, which, as we know, is associated with an increase in effectiveness of treatment. To very form of the test, when you can take a sample yourself at home and then deliver it to laboratory, is much more friendly for the patients and does not build a mental block before a test is performed. When it becomes to medical facilities, I believe that this introduction of such tests will complement their current offer, increasing the complexity. Knowledge about the possibility of performing such an examination should be available from a doctor of every specialization.
Excellent. Yeah. So could you talk a little bit about your decision process, how you came to work with BGI to launch this new product, this new screening method in Poland?
Yes, when I first heard about the Colotect test, I knew it was an amazing opportunity for our Polish patients. Our company has always been looking for innovative, modern solution to be able to provide them to our patients. As the Salve Medica hospital, we have been operating of the health market for many years. We understand that not all examinations are comfortable for patients. From our experience, we know that it's sometimes something difficult to persuade a healthy 4-year-old man to perform a preventive examination. In his opinion, this test is not necessary because he has no symptoms. From the very beginning, we pay a lot of attention to providing our patients with comprehensive medical care. So by introducing the Colotect tests to Poland, we received full support in the implementation from BGI. Their specialists supervised every stage of implementation. Our laboratory employers obtained certificates after undergoing a full cycle of training and conducting many cycles of tests. That gives both us and BGI a guarantee that study protocol is properly implemented and the results that our patients will receive will be fully consistent with their development and approved the test methods.
Mm-hmm. And Helen, could you maybe give your perspective as well on the partnership and how it's been working with Salve Medica, and maybe in general, the sort of the rollout of the product through Poland and the other countries in Europe that it's available in so far. Like, how's it been for BGI?
We have now been, rolling out some prospective clinical trials also here in China. So in these studies are currently underway, and some of them we have been rolling out data which really show that Colotect can effectively detect colorectal cancers and precancerous conditions. And we really have a pretty good, decent, positive predictive value. We call it PPV there. What it means is that as high as 70 to 80% of people who receive a positive test results and then went on to perform a colonoscopy would actually have positive findings in their colonoscopies, which are either colorectal cancers or precancerous lesions or polyps or adenomas. By surgically removing these lesions, they would really stand out a very good chance of preventing the colorectal cancers in the future. So we also have constantly been validating the performance, the sensitivity and specificity of the tests, and we have seen that the tests are pretty robust in identifying the disease conditions. So with that, we now are seeing more and more cases where people would receive our tests, the Colotect, and then go to do colonoscopy and then find either advanced adenomas or colorectal cancer cases, things like that. It really gives us a lot of confidence that by providing an alternative screening options to folks, then people would have a better chance of finding precancerous conditions and or in early stage of colorectal cancers, and therefore have a better survival. So with that said, we believe that by bringing this product now to Poland, hopefully we can help people there to better manage their health conditions with their colon and rectum.
Going back to sort of looking at the bigger picture, how could Colotect improve population-based screening? And could you tell us a little bit about how population-based screening works, how we come to have the sort of data on trends that we were talking about earlier in terms of survival rate and incidence rate?
Sure. So population-based screening really refers to a strategy of screening when the screening is offered to everyone or a subgroup in population, but usually based on common risk factors such as gender and age, but regardless of their individual risk factors. So the whole idea of a population-based screening is to sort of like maximize the chances of identifying the disease. And there are some good examples of population-based screening that people may be familiar with, such as the breast cancer screening based on mammography, and also pap smear screening for cervical cancer. And also the FIT test that I mentioned earlier for colorectal cancer is also a good example of a population-based screening because it's a relatively cheap test, so then it can be sort of like provided to the entire population. I think the idea of population based screening is important because colorectal cancer, when you sort of like think about the risk factors of colorectal cancers, mostly it's just age, right? So people above 45 years old or 50 years old are usually just recommended to start screening, regardless of their lifestyles. Although there might be people who have certain lifestyles would have a higher risk for colorectal cancers, but still, age is the single most important factors there. So this is why screening for colorectal cancer or population-based screening for colorectal cancer is very important. And still, I believe that in many different regions and countries in the world, the population-based colorectal cancer screening is still quite limited because, due to the factors that we discussed before, such as the lower compliance to colonoscopy, and also the fecal immunotest. Although it's a cheap test, but the accuracy has some limitations. So here we are bringing Colotect to the market because we believe that as a study-based test, it can have a very reasonable performance for colorectal cancer detection, so that it really provides a new sort of like alternative strategy for population-based screening. And we are very eager to see that with new trials and when people start to use this test, for example, in Poland, then we can start to see some good screening, the good results rolling out.
Excellent. And Anna, how do you think that'll apply, in Poland specifically, if Colotect can be used for population-based screening?
Yes, looking at the current colorectal cancer incidence and mortality rates, we have a lot of potential to improve these results. If the taxpayer would allow an epigenetic test such as Colotect to be included in the prevention program, we would certainly increase its availability to a wide group of patients. I'm convinced that it is the way we can change these graceful statistics. We can offer an alternative to the entire group of patients who cite fear of colonoscopy as an argument for not performing preventive tests. We can offer those patients do an epigenetic test more often and perform at home. If we make such tests available to a wide group of patients through government funding, we will teach Polish patients that by performing it's and as often as, for example, blood count or glucose, we can catch early stages of the disease, for which cure is much more possible.
Yeah, definitely. I think that's very promising. Okay, well, we'll wrap up the discussion there. Thank you both very much for your time. Do you have any sort of closing remarks? Anything else you'd like to mention?
Okay, so for my part, I would like to thank for opportunity to participate in this meeting. I'm convinced that we can a lot of subject of colorectal cancer prevention. From here, I would like to invite everyone interested to contact us for more information about Colotect test in Poland. So,
yeah, perfect. And Helen, how about you? Any closing remarks?
Well, first I want to thank Anna and thank the moderator and for this discussion. I feel very excited now to see how Colotect will help patients in Poland to sort of like manage their health. So yeah, we just wait to see how these efforts will roll out. Again, we will continue our efforts to perfect our solutions and hopefully bring more health management products to Poland and to the rest of the world.